Hi, my name is Carson. I'm going to be presenting today on adult obesity and health. So what is adult obesity first? It's defined by the CDC as a person who is 18 or older whose body mass index is measured to be at 30 or higher. So why does this matter from a recreation professional standpoint? We need to be able to create programs that appeal to people from all different weight classifications, but also programs that can mitigate those negative effects that obesity can have on adults from a physical, emotional, cognitive, and social standpoint. And as a society, we need to address this problem through participating in recreation in an inclusive and accepting way with people of all different weight classifications and help them to improve their quality of life. So first associated with the impacts of obesity are the physical ones. I've listed a lot of them, starting with diabetes, reproductive complications, heart disease and pregnancy complications, increased risk of stroke and a poor health-related quality of life, dyslipidemia, which is just a buildup of plaque in your veins and arteries, an increase in all-cause mortality, metabolic syndrome and decreased life expectancy, liver, gallbladder, and kidney disease, as well as an increased risk of hospitalization, asthma, cardiovascular disease, sleep apnea, obesity, hypoventilation syndrome, arthritis and non-alcoholic fatty liver disease, chronic back pain and bone disease, mobility limitations and joint disease, and lastly, cancers and heart failure. So obviously there are a lot of negative physical complications that come along with obesity. Next, there's a study. It's called The Impact of Obesity on Health-Related Quality of Life in the General Adult United States Population. It just took some data from a medical expenditure panel survey from 2000, and the respondents were all 18 and older and were classified in one of the 5 weight classes, and then measured by the 12-item short form for HRQR summary scores for mental and physical areas. The findings found that health-related quality of life decreased with an increasing level of obesity compared to the normal weight subjects. The severely obese people with and without chronic illnesses had significantly lower scores. So what we learned from these results is just that people with obesity, in comparison to all of the other weight classification people, have a lower HRQL score by a significant margin. And this is also a sustained result when you account for obese people with and without chronic illnesses that are associated with obesity. So why should you care from a professional standpoint about these physical impacts? Firstly, the obese adults are less likely to be able to engage in the programs that are available because of those physical complications that may occur or are currently occurring to them. Another reason is that the ones who do participate in the activities may not be able to fully experience or enjoy them due to those complications. And lastly, due to the decreased life expectancy that is very common in obese adults, they have fewer years to participate in any of the available programs that we put on. And there are some sources. There are also a lot of emotional impacts that may go unseen when compared to the physical impacts of obesity, but they're definitely still there. Some of these include depression, anxiety, a low quality of life, low self-esteem, body dissatisfaction, substance use disorders, and then there are a lot of relevant studies about these emotional impacts, such as obesity and physical and emotional well-being, associations between body mass index, chronic illness, and the physical and mental components of the SF-36 questionnaire. So this took about 9,000 randomly selected adults from 18 to 64 and measured their BMI, their chronic illness status, those questionnaire scores, and then there were 2 summary components that reflected their physical and emotional well-being. And these findings showed that 31% of the people were overweight out of that sample, and an additional 11% were obese. The BMI was significantly associated with things like their chronic illness status, but it varied in their emotional well-being. The subjects who were overweight and obese and also had a chronic illness were much more likely to see a marked deterioration of their emotional well-being than the ones who didn't suffer from chronic illness. So what we learned from that is that the chronic illnesses associated with being overweight and obese have been linked to an incredibly decreased emotional well-being. In emotional aspects of obesity, another study, 18 obese patients had psychiatric evaluation about their emotional well-being and found that some of the reasons for overeating that usually added to or caused the obesity in the first place was a reaction to intolerable life situations, a symptom of underlying emotional illness like depression, and malignant food addictions. So what we learned from that is that obesity is a psychosomatic syndrome, which is a physical condition that can be caused or made worse by emotional or mental condition or state. Last study, called Psychological Aspects of Severe Obesity, it studied overweight and obese people before and after an anti-obesity surgery and then the subsequent weight loss as a result. And before, they didn't find a single personality type that categorizes the severely obese or a higher level of general psychopathology compared to the control subject who were of average weight. And that some of the complications specific to that severe obesity were body image disparagement and binge eating. And after, they saw a marked increase in self-esteem, positive emotions, and healthy eating behavior. And if there was a degree of marital satisfaction beforehand, that satisfaction would increase. And there was a decrease in body image disparagement after the weight loss occurred. What we learned from that is that the feelings of rejection and shame in severely obese patients are definitely there, but they are no more likely to have a form of psychosis than a normal weight person. Why should you care from a professional standpoint about these emotional impacts? These higher levels of rejection and shame in obese individuals may result in a refusal to go out and participate in these programs, as well as them having reservations about trying these activities or interacting with other people in the programs. And lastly, they may not be able to go out and experience them fully or enjoy them fully. Much like those physical complications hindering them, the emotional areas also can greatly impact their recreational enjoyment. Next, there are cognitive impacts that are associated. In lower cognitive function in the presence of obesity and hypertension, the Framingham Heart Study, about 1,500 people were classified by the presence or absence of obesity and hypertension over a span of 18 years just to determine the independent effects of obesity and hypertension on cognitive function. And it was found in men that with a higher level of body mass index and blood pressure, there were lower levels of cognitive performance in the areas of learning, memory, executive functioning, and abstract reasoning. So what we learned from this study is that the effects of obesity on cognition are lasting, as these tests were taken 4 to 6 years after the initial measurements of these obese people were taken, and that these results were proven in men but have not yet been proven in women as of the point of the study. Obesity reduces cognitive and motor functions across the lifespan was another study that just compiled a lot of evidence through documental analysis to discuss the association between obesity with cognition and motor behaviors. It was found that there was a association between BMI and cognitive function, and it is present but a little bit weaker once the obese people start getting a bit older. The individuals who are overweight and obese are in the lowest quartile of global cognition, verbal fluency, delayed recall, immediate logical memory, and intelligence. Midlife obesity additionally has been related to accelerated cognitive aging in this area, and that both BMI and age contribute independently but significantly to decreased brain volume as time goes on. And Additionally, in middle and older adults, that high BMI and blood pressure is related to low motor speed and manual dexterity. So what we learned from this is that there's a lot of evidence of decreased cognition and motor function in obese people throughout their lives, and it only increases as they get older. And obese people have also been implicated through this study to use their attention resources to balance out those motor deficits. So not only are they losing those parts of motor skills, but they're making up for that by focusing the cognition that they could be using for things like abstract reasoning or executive function, and they're moving that brain power towards using their motor skills properly. A last study is interactive effect of obesity indexes on cognition. Now this study looked over just under 500 individuals who were over 65 in South Korea to look at the late age areas of obesity with waist circumference and BMI. And then poor cognitive performance was found in 37% of the sample, and that standard obesity and poor cognition were strongly associated in the presence of abdominal obesity. So that poor cognition was also negatively associated with overweight persons who had a normal waist circumference. So what we found through that is that, once again, poor general cognition is associated with obesity, and that abdominal obesity is especially associated with poorer cognition, especially at a late age. So why should you care about these cognitive impacts from a professional standpoint? That decreased fine motor control in obese persons is very important towards recreational and leisure activities that they might not be able to participate in due to not having quite the motor skills that they need to participate. It makes it a lot more difficult to be inclusive towards them for that reason, that they don't have the same capabilities as normal weight persons. And it's also important that obese persons and people of other weight classifications use their brains and bodies in the recreation field opportunity activities, just because you want to be developing both the brain and the body when you're doing those activities, and obese people are not going to be as able as other people in that way. Lastly, there are the social impacts that are associated with obesity. The spread of obesity in a large social network over 32 years. That study looked at 12,000 people over 32 years of measurements, and it just looked at the clusters of obese people within social networks, the association between one person's weight gain and the weight gain amongst their social ties, and then the dependence of this association in the nature of the social ties that occurred. And then also the influence of sex and smoking behavior and the geographic distance between the people. And among these subjects, there were just over 5,000 egos who we studied the ties near them. So just to sum up a lot of the findings, there were just under 40,000 ties between all of these people in the study, the 12,000 branching off of the 5,000 egos. So 83% of the spouses of the egos were involved, 87% of the siblings, 10% of the neighbors, and 45% of the friends. There were always clusters of obesity found in these networks, but they weren't solely attributed to obesity. The odds of becoming obese increased 57% if it was a friend who became obese in a certain interval. This increase was 40% with siblings, 37% with spouses, but no percent with neighbors. And the same-sex ties had a greater influence than of opposite sex on each other. So what we learned from that is that an association is found between an obese social contact and usually their spouse or sibling, and they're also the egos influenced by the adoption of smoking, poor eating habits, and poor exercise habits by those social ties that they have. Through causes and consequences of adult obesity, health, social, and economic impacts in the U.S., we can also look at some of those negative results. They looked at the National Institute of Health data for multiple areas just to study this. They found that obesity is the 7th leading cause of death in the United States, and that the total cost of overweight and obesity, by some estimates, is $100 billion annually. And the reason that this specifically ties to social impacts is that economics are a huge part of social life in your socioeconomic status, and then the health that you are able to afford with the money that you're losing through the obesity that is there. An additional 40 million workdays of productivity are lost, 63 million doctor's office visits are made, 239 million restricted activity days, and 90 million bedbound days. So, as you consider the numbers brought up by these millions of days and hours that are lost, that's a lot of money that adds up for any person. And the less money that is available, you can see that there's a more difficult time to be able to participate in these sorts of recreational activities, which do tend to cost money. And additionally, the low work performance adds to those feelings of rejection and shame that are found on the emotional aspect of that. Again, the stigma of obesity is another study that was a documental analysis to determine the impact of obesity stigma socially. Obesity discrimination was found to have increased 66% over the past decade. There's also now a National Association to Advance Fat Acceptance that has been working overtime to mitigate that negative discrimination. And a doctor from the Eating Disorder Center of Denver reports finding a large percentage of clinical depression in obese people as well. So what we learned from that is that obesity discrimination is a real problem, and obese people are continually being brought down in terms of emotional well-being and having a harder time making those strong social ties that they need to due to their obesity. Things like having fewer friends and then, like I said, the social discrimination and stigmatization are some negative effects on the social area of obesity. Additionally, a lower chance of being employed and employers' discrimination, a hiring prejudice, and lower wages are seen. Lower educational attainment and work impairment. Obese people are more likely to commit suicide and take time away from work, and are less likely to marry and more likely to divorce, as well as seeing a massive disruption of work, family, and social life. So why should you care about these social impacts? Both professionally and personally, the social impacts have a sway in the recreational field. As I said, with that lower level of employment and wages, as well as the discrimination that is seen, obese people are less likely to be able to afford to participate in monetized forms of recreation and leisure, which tremendously cuts down on what they're able to participate in. And additionally, even if they are able to afford that, they do have a possibility of having fewer friends than individuals of lower weight classes, so they're less likely to participate in group leisure activities. And without reaching out to these at-risk adults, obesity can spread further through the social networks. So finally, why addressing this problem is important is that after you consider the evidence that reveal the physical, emotional, cognitive, and social impacts of obesity, it's very clear that we need to do something. And this can be achieved through using inclusive recreation and leisure programming to stop or mitigate the negative effects of adult obesity. Thanks.